In Chapter 11, we'll be discussing burns. There are many different types of burns, and we have to understand that they can occur in many different variety of settings, for different reasons, among different age groups. Skin death and injury occur as the heat exceeds the body's ability to get rid of it. So the damage depends on the intensity of the heat. How long has that heat been in contact with the skin, and what is the thickness of the skin? There are burn classifications. One of them is called a thermal burn. It's caused by flames, hot objects, steam, hot liquids. Chemical burns are another classification of burns caused by many chemicals that could be acids, alkalis, or organic compounds. There are electrical burns, and that's caused by contact with an electric current. And the injury depends on what type of current you come in contact with, what the voltage is, what part of the body has been exposed, and how long have you been in contact with that electrical current. We need to evaluate a thermal burn. You need to determine the depth of the burn. First degree is superficial, similar to a sunburn. Second degree, or partial thickness, usually has blistering, and third degree, or full thickness, is where the skin is actually charred. We need to determine the extent of the burn, meaning how much body surface area does it cover. When you think about the hand, a hand represents about 1% of the person's total body surface. You need to determine which body parts are burned. Burns on the face, hands, feet, and genitals are the most severe. Determine respiratory involvement. Superheated air, when it's absorbed by the upper respiratory tract, can cause swelling, and it restricts or shuts off the airway. That could happen in as little as 2 to 24 hours. You have to determine whether there are other injuries present, any medical problems that exist, the person's age, whether they're over or under 55 years of age or under 5 years of age. Determine the burn severity. There are minor burns, moderate burns, and critical burns. First degree burns are minor, that cover less than 50% of the body. Moderate burn is a second degree burn that covers 15 to 30%, for example. Critical burns are third degree burns covering more than 10% of the body in adults. And table 11.1 goes through all of them. I'm not going to repeat each one of them, but read this table because it really helps explain the difference between minor, moderate, and critical burns and what determines the burn's severity. First degree or superficial burns, look for redness, swelling, tenderness, and pain. Apply cold water or compress, give ibuprofen, elevate the extremity, drink water, and apply aloe vera lotion to help soothe the burn. For a small second degree burn, look for blisters, swelling, seeping of fluids, and some pain. Follow the first 3 steps for first degree burns, then the difference is in this one you would apply an antibacterial ointment and cover it with a loose, dry, non-stick, sterile dressing. For a large second degree burn, follow the steps in the first degree burn and then apply cold. Monitor for hypothermia and call 911. With third degree burns, you want to look for dry, leathery, gray colored or charred skin. Cover the burn with a non-stick, sterile dressing and call 911. After you have been treated, you want to follow the doctor's recommendations. Wash your hands before changing the dressing. Leave unbroken blisters intact. Change the dressings daily. Look for infections. Elevate the burn for the first 24 hours and take pain medicine if needed. Scald burns happen when you come in contact with hot liquids. Immersion burns means an area of the body is fully immersed in a hot liquid. Spill burns, the liquid spills, drops, or liquid is thrown on a person. Sunburn is a trauma of ultraviolet radiation, and it can result in first or second degree burn. Sometimes a sunburn gets so bad that you can blister. You want to apply a cool compress for 45 minutes. Take cool showers. Don't use benzocaine. Use ibuprofen to reduce the pain and swelling and inflammation. Drink a lot of water and use aloe vera to soothe the body. Sunburn Aftercare, you can apply an antibiotic ointment to a second degree burn. If the blisters break, gently wash twice a day and seek medical care if the eyes are affected or if any sign of infection occurs. With chemical burns, as they're a result of an acid or alkali substance that comes in contact with the skin, chemical burns as long as they are chemicals burn as long as they are in contact with the skin. So check the safety data sheet if available. Look for pain, burning, breathing difficulty, eye pain or vision change. Brush dry any chemicals off the skin, and flush the burn with large amounts of water for at least 20 minutes or until the EMS arrives. Call 911. For a chemical in the eye, tip your head so the affected eye is below the level of the nose. Wash with warm water from nose out to the side of the face for at least 20 minutes. With an electrical burn, there are different types: thermal burn, arc burn, and a true electrical injury. If you come in contact with outdoor power line, the power must be turned off. A tingling sensation means you are on energized ground, so you want to raise one foot, turn around, and hop to a safe area. Don't attempt to move any wires. If you're inside buildings, turn off the electricity, unplug the appliance. Do not touch appliance or person until the current is off. Damage occurs under the skin. With electrical burns, look for the burn wound might appear small. Look for entrance and exit wounds, multiple burns, and if there's no breathing or pulse. So electrical burns can be very, very serious, and you have to look and assess and always call 911.